Good afternoon, everyone, and welcome to today's webinar entitled Emergency, How to Prepare and Meet Regulatory Requirements. We're so glad that you could all join us today as we have such an exciting and insightful presentation in store for you today. My name is Deanna Fenton, and I'm the Program Coordinator for the Alliance. Now, we do have just a few logistical items to review before we begin today's program. For those of you who have never joined us on this platform before, the chat feature is located in the bottom left-hand corner of your screen. Now, we are recording this webinar, so we will not be opening the phone lines during today's presentation. That means that all questions must be submitted electronically using this chat feature. If you have any questions that come up during the webinar, please feel free to submit them at any time. Once the presentation is complete, we'll allow some time for our presenters to address as many of your questions as time allows. Registration is currently open for our next webinar entitled Penile Transplantation, Restoring Confidence and Identity. That's coming your way on October 17th at 2 p.m. Eastern. Registration is also open for our upcoming webinar entitled HIV, Let's Have Hope. That'll be coming your way on October 25th at 3 p.m. Eastern. You can register for all of these webinars and more on our website at organdonationalliance.org. Now, for those of you who may be interested in continuing education credit, we are offering one Set C credit and one nursing contact hour courtesy of Iowa Donor Network. Everyone listening to today's webinar is entitled to claim continuing education credit. Now, if you're listening in a group, as many of you are, please make sure to get the evaluation email from your group lead. It's a very brief online evaluation that will allow you to receive your credit. Just as a friendly reminder, for nursing you have 14 calendar days to claim your credits, and for Set C you have 30 days. Now, at this point in time, I'd like to introduce you to our moderator, Jacqueline Manzanito. I'm sorry if I'm pronouncing that incorrectly. She's the Manager of Donation Partner Development at Donor Network West. Jacqueline, we're so glad to have you with us today, and at this time, I'd like to turn it over to you to introduce our speakers and begin today's program.
Thank you. Thanks, everyone, for having us and tuning in today. I'm really excited and really honored to be participating today in this discussion, which is so timely and sensitive in this sort of era that we're in of lots of different natural disasters that have occurred. So within our mission of helping other people and doing this human-centered work that we do, we certainly want to kind of check in with our colleagues and see how that experience has been for them. For those of us who've had experiences like that, or those of us who have not, and particularly because there are some new CMS guidelines. So I would like to introduce our speakers now. I'm just going to run through a little bit of their bio for the background, and they're going to go into a little bit more detail as well about what they're going to share today. So with us is Kelly Ranum, who is the CEO of Louisiana Organ Procurement Agency in Louisiana. She has been with LOPA for 23 years, holding multiple clinical and managerial positions prior to becoming the CEO in 2001. So over the last 18 years, she's led the organization through multiple hurricanes, mass flooding, and winter events that are not normally experienced in Louisiana. We're also joined by Jessica Leibold, who's the Senior Director of Facilities and Purchasing at Life Gift in Texas. Jessica has been with Life Gift since 2006 as the construction manager, owner's representative to oversee the demolition, renovation, and construction of their corporate headquarters, as well as a Fort Worth regional facility. She at that time accepted the role of Managing Director of Facilities and Purchasing for all of Life Gift's offices. She has more than 25 years of construction management, facility management experience, and her projects have been awarded by the Association of General Contractors twice, with Life Gift receiving a 2008 Apex Award, the Industries Award for Project Excellence, and during her time at Life Gift, she's gone through Hurricane Ike in 2008, and Harvey in 2017, which, as we know, had huge impacts on Houston. We are also joined by Guillermina Sanchez, who's the Associate Executive Director of LifeLink of Puerto Rico. She's been at Puerto Rico LifeLink since June of 2010. She's responsible for overseeing and managing the clinical operations of the procurement organization. And some other areas she's managed in the last 8 years cover quality improvement programs, hospital development department, safety, family services program, compliance aspects, and organ and tissue recovery departments. She also oversees the accreditation processes and compliance with state and federal regulations in alignment with the foundational level policies. She and the OPO leadership work under extraordinary circumstances after Hurricane Irma and Maria hit the island in September of last year. And last but not least, we have David Marshman, who's the Director of OPO Quality Systems for OPTN and UNOS Operations and Safety Committee member, as well as LifeLink Foundation in Georgia. He is the Director of the OPO Quality Systems for LifeLink Foundation, as I mentioned, and he works with the 3 LifeLink OPOs, LifeLink of Florida, Georgia, and Puerto Rico, to assist with their performance and process improvement, and of course ensuring regulatory compliance. He's an active member of both AOPO and UNOS, having served multiple committees as a member and a past committee chair, and he's shared on many topics related to organ donation process on local and state and national level, as he is today. So thank all of you for being here. I just can't wait to hear what you have to share. We're doing this webinar a bit more like a kind of dialogue, maybe podcast type if you are into those. So I'm really interested in having a good dialogue with all of you and hoping to dig a little deeper into your experiences. So we're going to have some fun today and hopefully learn a lot too. So the first speaker to share is Jessica Leibold out of Texas. So Jessica, would you
Thank you, Jacqueline.
Yes, absolutely.
Well, back in August 2017, August 23rd, it was realized that Hurricane Harvey was going to have a direct impact on Life Gifts donation service area. That's when the executive leadership team met to discuss the plan of action on August 24th, with initial steps to determine whether office status for the 25th was going to be open or close our facility, making arrangements for both remote call center specialists and as well as hospital staff who would be working throughout the storm. The executive leadership also discussed when it would be necessary to shut down tissue operations to protect staff in the communities we serve. It was determined that emergency supplies and surgical inventory needs had been ordered and available, and a crisis communication plan was presented on August 24th to discuss vetting to communications that should take place during the emergency. Life Gifts emergency notification software was tested on the 22nd and used for internal communications over the next week. During the storm, the ELT met twice daily, checking in at 8 a.m. and again at 8 p.m. to discuss day-to-day activities and assess the unfolding situation. During these calls, it was determined that messages would be sent to the Life Gift employees through that vehicle. Office status was discussed and announced via text and email and phone calls each day from August 27th through September 1st. Each ELT member was asked to touch base with their staff daily. All staff was accounted for, and the conditions of their homes and vehicles were communicated. It was also agreed that training for disaster response needs to be conducted and tabletop exercises needed to be conducted so that we're always adequately prepared. As far as the transplant centers here in Houston, all 3 transplant programs in Houston suspended transplant operations for 5 to 7 days during the storm. But we were very fortunate in the sense that we have 3 regional offices, and so our clinical operations continue to go on.
Wonderful.
We sustained very little damage to our actual corporate office but our biggest challenge was that our staff and our lost their residence or vehicles, and it was all about trying to get them back up and running. And we actually implemented a GoToFundMe account and raised over $300,000 for our internal staff.
Oh, wow. That's amazing. So I want to hear a little bit more about each individual speaker's kind of primary event, and then we're going to go into some more questions to get into the experiences a little bit that you've touched on and kind of how you dispatch some of those resources in the moments and maybe things that came up that you weren't expecting. So the next speaker that I have to share their experience is Guillermina Sanchez. Can you tell us a little bit about what Puerto Rico endured?
Sure, and good afternoon, everyone. Thank you for the Alliance for the opportunity. As you can see on your monitors, Puerto Rico was severely hit by not one but two hurricanes last year during the month of September. Hurricane Irma at the beginning of September and Hurricane Maria on the 20th of September. Hurricane Maria actually was the one that caused most of the damage that you can see in the pictures. And it really, not preparations could ever prepare us for what we confronted. This is something that we did not imagine. A hurricane this strong had not hit Puerto Rico in the last 20 years, which is ironic because Puerto Rico is in the middle of the Caribbean, so you will expect for us to be hit more frequently. Fortunately, we're not. And I'm very eager to share during the rest of the meeting today some of our experiences and our lessons learned.
Wonderful, thank you. David, you were acting as a kind of support resource in many ways for Puerto Rico. Can you share a little bit about your experience of being in that position for those agencies?
Sure. So thanks, Jacqueline. So basically, as the foundation, we provided support to Puerto Rico during this time. We helped them with, their donation responsibilities and some of the things that they needed to take care of. But we also helped them to just locate staff and to, ship supplies to them and just get them to help to meet some of their basic general needs. So it was very important for us, as it was quoted in the very beginning, that we recognized after this hurricane that we didn't, that we really had a humanitarian issue and not just about donation. It was so much more than donation, but it was really just trying to provide whatever support we could to the Puerto Rico staff and the team in Puerto Rico.
Excellent, excellent. Thank you, David. And Kelly, out in Louisiana, can you share a little bit about your event?
Sure, we've had a few. The first two pictures are actually from Katrina, which was 13 years ago, this past August. A lot of the things that were in place today were not in place back then, particularly cell service and ancillary preparations from FEMA. So a lot of things were learned during that time that I think have helped in some of the transitions of events that have happened since. So down in the bottom left-hand corner, that was actually a rainstorm. Baton Rouge went underwater after 2 days of heavy rains, and that is now our #1 donor hospital is in Baton Rouge. So we've had a lot to go through with that just from rains, not even a hurricane. And to point out that not all crises have to be large ones related to natural disasters, but that small little hole on the right-hand side of the page in the roof is a lightning strike, and it completely took out our communications center for 3 days. And so it's varying degrees of crisis that you have to deal with, and not always related to weather events per se and hurricanes. We also, which don't have pictures of, but this past winter we actually had a week's worth of cold weather below 30 degrees, and all of our roadways were frozen from Mississippi to Texas to Arkansas, with no travel allowed. So we've had to deal with a variety of issues over the years.
Wow, wow. Well, we certainly, I think, can pull a lot of information for any state that we live in any OPO we're operating in, from the things that you're going to be speaking about today. So thank all of you for being here. And for those of you listening, just to kind of bring back to some of our goals for today, as you're probably aware, OPOs and transplant programs are required to have emergency plans in place to avoid disruption in service. So that's a newer regulatory requirement, which is why I'm so glad we're paying some attention to this and the experiences of our colleagues. So we're going to learn from these OPOs how to best prepare for an emergency and how to meet the CMS requirements. So we'll take a look at several themes. The first of which would be communication, how we're communicating with staff, how we're communicating with each other, what our methods of communication might be. We'll talk about operations and staff. How are we caring for the people that are out there doing the work who might also be affected by, by the event at hand? And then the third one would be the aftermath. How have you and your OPO coped in the aftermath? What were your main takeaways? What do you wish had gone different? So we're going to touch on a couple of those things. I do want to encourage folks, if you have any questions, please send those questions in, and we will get to them at the end of the hour. And like I said, we were hoping this would be a little bit more of a conversation and Q&A time, so that if you have something specific to ask, we'll try to get that addressed. So send them in at any time, and we'll hold those to the end. So I have a couple questions surrounding communication, and please feel free to kind of take this whatever direction works for you. And if anybody else wants to jump in, we will focus on that as well. I'm trying to get your little pictures up on the screen there when I speak with you. Okay, so my first question is actually for Kelly. So I'm going to try to get Kelly on the screen there. So Kelly, what did you put into place to meet the CMS requirement at your OPO? Were you prepared ahead of time to the storm? Did you have a coordinated guide, or was that something that you were in process of developing, like many of us are, when this event occurred?
So in 2005, I think nobody talked about disasters. We had some unofficial plans in place, nothing solidified, or we used to have a phone tree, which I'm sure a lot of people will laugh about, and not a cell phone tree, but an actual landline phone tree. And in all honesty, it's as much as it makes me chuckle today, it's really what saved us, because landlines didn't go down or out, and the cell towers did. So our event lasted for weeks, and we had issues with reentry, the cell towers not just knocked down, but batteries going out on the cell towers, so they weren't working at all. So really a lot of the plans that we formed on the fly, if you will, have been solidified over the years to meet the CMS requirements. And I think that for us, we had that guide. We just had to put it in a format that CMS would like and approve. But we had lived through most of what they had actually, required in part of the planning. So we were prepared.
Were your hospitals affected by that as well? The donor hospitals and your transplant centers? Obviously, I would think.
Yeah, our hospitals very affected. We had hospitals that went on lockdown, military lockdown, that we weren't allowed to get in. We had airspace that was locked down that we weren't allowed to fly through or over or near. So there were a lot of other issues that probably I don't even know if they come up since, but we actually had to deal with a lot of that. So some of our hospitals couldn't even call in referrals at that time just because of those considerations with the military taking over. And what we actually found with the transplant centers is they didn't have a plan either. And a lot of recipients ended up calling us wondering how to get in touch with their doctors, how to get in touch with the hospital, because the hospitals actually shut down operations as well. And it took them a few days to actually get up and running in other facilities that they owned. So we became the point person for everything, and that was not something we were necessarily prepared for, particularly communicating on behalf of the transplant centers. But luckily we had conversations on the front end with our HLA, our serology lab, which also went underwater, and our transplant center. So we at least had key contacts, and we have since solidified all of those contacts and then expanded that out to include all of the donor hospitals as well.
Right. So many different agencies that come up. I didn't even think about the lab, so that's absolutely something super mission critical. So, okay, so everything you learned from that event kind of went into your guide, huh? Was it pretty similar to what you had come up with beforehand, or ideas that the leadership team had beforehand?
I think technology advanced, so we were able to utilize that more. So we have an actual a website that we developed that's an emergency website that has all of the information for transplant centers, donor hospitals, key contacts. We also have a more or less a blog that leadership blogs out to the staff. The staff put their location in it. When their location changes, they put it back in, that they're going to somebody else's house, or if they don't have access to the internet, then they are able to contact their management or the direct manager or director, and then that information is put in the system. So we've been able to really track people in a more effective way with the use of IT and just technology.
Excellent, excellent. Thank you, Kelly. I'd like to ask, sort of along the same lines to Guillermina, what was your communication like with your staff? Did you have cell phones working at that point? How did you keep updating your staff?
Well, in our case, very similar to Kelly, we had all the cell phone towers were basically either gone or shut down. There was no power in the whole island, so the cell phone towers that were working had no power to be able to transmit a signal. So what we did, we have a weather line, and we constantly communicated to the staff through the weather line. We also have Bolo system, which is a communication system that will email and send text messages to the staff. However, we knew that was not enough. That was not going to reach everyone. If people could drive and remember roads were basically not be able for anyone to transit, but if you could go to an area that you might get signal, and then at that time get those messages. But we had one radio station left working in the whole island, so we put a lot of messages through the radio station for staff to know what was going on with our operations. We also were able to communicate to the staff through social media. And another resource that we use is the WhatsApp tool that many of us use for our families and friends. That actually was able to contact a lot of the staff as well. But it was definitely a challenge, and it remained a challenge for many months after the storm hit.
I can imagine. Wow. Kelly, did you have similar unexpected communication considerations? Were there anything that came up that you were not anticipating?
I think the recipients were definitely something that we did not anticipate, and their panic for how to get medications and where are they supposed to go for their appointments, and so that was something that we had to work into our emergency website so that they had the ability to get that information, and that's something that we've utilized that information and moved forward to continue to keep that information, even though the hospital systems now have better plans and actually probably more resources than we do, but we still keep that as a backup because a lot of our volunteers who are the recipients knew only to call us and weren't sure where else to go. So that one was very unexpected.
Right, right. And Jessica, out there in Louisiana, what about communicating with the hospitals in your area? What was that like?
Communicating with the hospitals here in the Texas Medical Center wasn't as big of a challenge as we had thought it would be. The TMC, members of the TMC are text or emailed and given updates for each of the institutions involved. In Houston, we did have our transplant centers suspend, operations, but again, we have offices in Fort Worth and Lubbock who were not only our backup, but as well as we were recovering and operational in those areas. We also, with our call center, we had remote employees for the call center located in different states across the U.S. So they were able to communicate with us and for us and get those referrals.
Oh, good, good. So kind of shifting gears here to an operational perspective, certainly the communication is kind of the first and foremost, but then it really comes down to how are we going to get the work done that needs to be done and keep people, keep transplants happening if that's where we're at. And so I'd like to hear from Guy or Mina kind of what type of how were operations at that time for you? Maybe kind of early on and then through the process.
Well, it was definitely a challenge. We remained semi-operational for around 2 weeks. We had someone before, during, and after the storm in our main trauma center, which is a medical complex with around 6 hospitals. So that's where we do 50 to 60% of our donors, so we were able to have presence throughout. And I can tell you a couple of days after the storm, so maybe Saturday, Sunday, we already had someone going back, doing rounds, and be able to continue our operations. We also are very fortunate to be under the LifeLink Foundation umbrella, and we have redundancy with LifeLink of Florida, who provided support especially in the referral coordinator role for almost 2 weeks, and was that primary contact with the hospitals while we were trying to go back to our new normal.
Absolutely. And so that brings up for me, David, if you can speak to that, because while Puerto Rico was affected by the storm, Florida and Georgia were also impacted. So how did that sort of backup plan work for you?
Thanks. That's actually a great question. And so, we have, because we are 3 OPOs strong, a lot of our redundancy is based on those 3 OPOs. And as one of the storms moved through, it actually impacted all 3 of our service areas. So we had to step back and do a little bit of reevaluation and readjustment in the moment to figure out how to ensure we could maintain continuity. This meant establishing and reevaluating how we received calls, and even on the fly establishing an alternative backup, if you will, 2-hour backup for referral calls as both Tampa and Atlanta were impacted. So it was really evaluating what are other options that we may have available to us, and then in our lessons learned in that process, we incorporated those into our communications plan and into our preparedness plan for future.
Nice, nice. I can imagine you were in constant communication between your agencies and Puerto Rico's as well.
We were very, very much so.
Mhm. Mhm. So let me shift to Kelly. How did you work with the transplant programs to meet patient needs that came up for you in Louisiana at that during, I guess, any number of the of the storms that you'd endured?
I think our transplant centers are associated with other facilities outside of particularly the New Orleans area. So we're pretty fortunate in that when we do get hit by a storm, it's usually isolated to an area. So if New Orleans is getting hit, then Baton Rouge and Lafayette and the northern half of the state are still okay. So lessons learned from Katrina were to shift operations into other locations, and so we just helped to point potential recipients, into the locations that those transplant centers are actually operating in. So now they're, like I said, that their actual plan is much more in place and put together, and resources devoted to it, courtesy of the new CMS regs. But back then, 13 years ago, nobody really even thought that you would shut a hospital down for a hurricane, nonetheless that it would be shut down for a week or 2 weeks, that even the water supply that they have to the hospital is gone. There's no sewer systems, and trying to get things in and out of the hospital were, it's just impossible. And I think Puerto Rico probably identifies with that more than anybody else. So we just did what we could to connect people, to be the resource, to have our outlying offices be that contact for the transplant centers, and it's what we continue to do.
Yeah, and boy, the scale of what we're talking about today is it's still mind-blowing to imagine trying to do your normal days activities, especially when what we do has such an impact on people who are waiting for transplant.
And we were pretty similar.
Go ahead.
We were pretty similar to Puerto Rico in that we had two storms. So we had Katrina come through in the New Orleans area, and then a week later we had Rita come through the western part of the state. So everything that happened in the eastern part of the state happened in the western part of the state a week later. So it ended up being more of a majority of the state issue to deal with.
Statewide, wow. And so I know that some of our staff are probably hourly, and so I want to ask Jessica, did you shift any of the scheduling for staff? Did you kind of have the same schedule? What did operations look like for you during the worst of it?
Well, I think the most important thing was once we established where our staff were in terms of their amount of damage that they might have suffered, everybody else had kicked in and stepped up to the plate, but all employees were given 5 weather days during Harvey, and that was paid leave and not charged as vacation time. But also, in the midst of all this, our director of finance, she was displaced from her home and remotely funded payroll, which under these conditions was essential for most of our employees. And making sure that we as an organization were able to supply them with surplus and necessities. And when it was clear to how many of our employees were directly impacted, our CEO and CFO, along with the unanimous support of our board of directors, like I said, established a GoFundMe campaign. And we hired an outside third-party objective counsel to set up the guidelines, and which was key. That employees were asked to complete a thorough application, and a third-party consultant decided how to distribute over $300,000 that was eventually raised. But of course it was take care of family and yourselves first, and whoever wasn't in fact impacted picked up the slack. And so it all brought us together as one as well.
And Jessica, staying with you for this kind of the aftermath perspective, as the facilities expert, I'm sure in Texas for your OPO, what considerations did you have after the storm passed? What were your first concerns?
I thought it was, I had been here during Ike, and we had no one staying back with the building, so I stayed back with the then CEO. Security kind of just scattered, and I think it's important for someone to be on site to basically report or minimize the amount of damage that is going on to our facility, for one, and also to be able to report to the others what the facility conditions are. Evaluating the extent of the damage, whether the building was safe to come back to work to or not. Although we had experienced minimal damage, our elevator pit was flooded and meant that if I had someone, who needed to get to the second floor by elevator, that person would be able to get there. So I think doing a full assessment as far as how the building performs and how safe it is, putting in our insurance claims, taking photos before everyone gets back into place and comes back to the facility to work.
Yeah, well, what a resource you are for them in that capacity, I would imagine. Guillermina, can you talk to me a little bit about the aftermath? Because I feel like you must have had a long aftermath from the storms. And how are things today? Can you speak a little bit about what your new normal looks like at LifeLink?
So I'm happy to report that even though our new normal is different in terms of we still have many roads that are not recovered or been rebuilt, we still have bridges that are gone that are still pending to be rebuilt. Roads. So that a for the staff still are very often. Staff are controlled. However, our and our staff commitment remains even bigger than before. Hospitals suffer a lot. Many of the hospitals have to redo 50% of their buildings. So we have many hospitals that the OR were gone. We have hospitals that the ICUs were gone. So you can imagine how that impacts the overall function of our OPO. We have had a lot of exodus from physicians going to the mainland, and a lot of exodus from specialized nurses. So that we have to be very creative, especially in the hospital development role, to go back and start from square one to make sure that everyone in the hospital understands the donation mission continues regardless of the situation that has been going on.
Absolutely. I would not have considered the impact to the hospital development piece from that same perspective. So thank you for pointing that out. And then lastly, I want to ask, I think, Kelly, have you followed up with staff who've been affected by the event? Can you talk a little bit about what staff care looked like for you in the aftermath?
I think it was a lot about being patient and giving people the time that they needed. The staff that weren't in affected areas volunteered to come in and gut houses and bring supplies that you just couldn't even locate anywhere else, food, water, whatever that might be. And that's the same thing that happened not just in Katrina but in the flooding that occurred 2 years ago in Baton Rouge and Lafayette. You just got to give them a lot of time, and I think Houston talked about having a 5-day period where they paid their staff. I think it's really important on the front end to decide what you can financially afford to do for your staff, and I think you need to be prepared for that we weren't in some senses during Katrina. We just paid people even though it was months before we were really fully back and operational. It just seemed like the thing to do. We've had to readjust some of that thought process and relook at how we can afford to keep the staff, because the volume of staff we have now is tremendously different than we did 13 years ago. Just knowing what those time frames are. Is it a 5-day window period? Is it 5 days plus their PTO time or vacation time that they have? And I think that's just a really important thing to do. And staff care, having them have people they can talk to, making sure that you're in touch with where they're at so that you know whether they can do cases or not. You don't want to really put somebody that's very fragile and still trying to get their life back together out there with a donor family and have that potential to, have a situation occur. So it's pretty devastating when you lose everything you own. And I think until you've been in that situation, you can see pictures and you can hear about it, and and it doesn't just last for a month or two, it lasts for years. But definitely for 6 months, it's a lot of patience from a managerial perspective to give people the time to recover and get their life back together.
Absolutely. I think it's important to recognize those things, and I'm sure your staff really felt the support of their leadership recognizing that. So thanks for highlighting that. I want to move into now kind of some key learnings. So I know that each of you have a slide or two to share. So if you could just take each maybe 5 minutes or so to kind of go over your main takeaways that you would give, sort of an elevator speech, if you could, to your colleagues here around the country who are tuned in. Jessica, would you like to start?
I'm sorry. I think one of the most important things, obviously, is finding new and inventive ways for communication, whether that be through an intranet, whether it be, we have a one-call system, which emails, faxes, and whatnot. But although we have done thorough risk assessments of all different scenarios, you're never really prepared for what was about to happen. And so I think the most important thing is to get everybody on board, everybody to, be there no matter what it takes. But as our CEO once said, it's at the end of the day, it's all about people. And so just bringing the human element to this, any of these disasters that could happen, and the ways that we could help one another. We took for granted after the storm, we had plenty of stock supplies we take for granted, all of a sudden you can't find shoe booties, you can't find, surgical masks, different different industries are using supplies that we typically take for granted. And so there was a lot of, I think, camaraderie around all of the OPOs that offered to help or donated or, sent us supplies. We had vendors actually rent trucks and drive down supplies to us. It was really humbling.
That's such a great thing to point out. I feel like Texas is known for that, but it's absolutely wonderful to hear that happened for your team when all of this was going on. And I love this after-action review kind of form that you have up here. Was that shared with your staff?
Yes. We actually, we actually gave them a survey, asked them what they would like to have seen different, and we tried to, accommodate for sure.
Oh, a survey is a great idea.
Yeah, and they gave so much of themselves to our donor families, our recipient families, and so the GoFundMe page was really a big hit, and it was able to relieve some of their pressures a bit.
It sounds like it. That's wonderful. That's wonderful. Guillermina and David, do you want to share a little bit about your main takeaways from your slides?
Sure, I'll share a couple of slides. In terms of the staff, which was our main emphasis in terms of making sure that they were safe, and this sounds simple, but make sure your staff is trained upon hire and annually. At the time of the storm, it's not the time to train someone. You can start at the beginning when they're hired. Going back to the communications piece, identify an alternate phone number for employees to be reached after the storm. Surprisingly, some of the staff had AT&T and others had T-Mobile, and AT&T was not working, but T-Mobile was, and it was the wife or partner or a friend or their mom, and that way we were able to reach them. Also, we mapped the staff of the homes of the staff to know how it was the path of the storm going to affect them, and that way we had a better idea of which staff is going to be more affected in terms of trying to reach them first, give them assistance first. I cannot stress enough how important it is to meet frequently, and as soon as those meetings are done, to pass that information to the staff to make sure that we have a sound plan and we are prepared. And this last one that I'm going to share on this slide is very important. Provide time for the staff to complete their own preparations. We gave the staff a day and a half before the storm hit to make sure that they were prepared at home. It will be difficult for us to ask them to do something after the storm if we do not allow them to be prepared at home. And that, believe it or not, creates a peace of mind that they are doing what they need and that their family is taken care of. In terms of continuity of operations, I already mentioned that we had a staff assigned at the Centro Medico area, but also we had a vehicle parked there with supplies. We were concerned we would not be able to reach our office and get supplies to do at least a couple of cases. So we make sure that we had one vehicle parked in a safe location. We had tested all the calls to the transfer backup system for our call center, and thank God everything worked fine. The redundancy that David mentioned, it was key. Definitely without the backup of LifeLink of Florida in particular, we would have not been able to go back and be operational so soon. Something else for your staff, acquire solar chargers, satellite phones. These will be satellite phones will be your main mechanism of communication, and solar chargers, if no one has power, that way at least your staff are able to charge their phones. And constant communication with the local transplant centers, regulatory agencies, the government emergency command, etc. And an advice is for you to designate at least someone that will be that key person in communication constantly with all these agencies. On my last slide, even though I think that we went through a situation that we thought it was going to take months to recover, we were able to go back and did our first attempt for a case on September 28th, and on October 13th we did our first two cases, one in the metro area and another one in the south part of the island. This had major logistic issues. Hospitals were on generator. ORs had to be delayed because air conditioner temperatures were not proper at the proper temperature. So you can imagine how that made us extremely patient. But at the end, we were able to procure and save lives.
Thank you. Thank you for sharing that. What an experience that must have been. And our last speaker is Kelly. Kelly, this is your opportunity to share some takeaways for.
Internally, we have A and B teams. So when storms are triggered, our A team is the one that goes home and does the preparation. I completely agree. You have to give them time on the front end, not just on the back end. And then there's a 3-day window for that A team to be in operation, and then the B team will come in and relief. So that's been a really big thing for us, is to have those teams assigned for both organ tissue development, family approaching. We also have a system where we can mass page everybody, and all of our staff, including finance, administration, quality, they're all on that same system. So they get they're called red oxygen alerts. I would encourage everybody, if you have a governor's office of Homeland Security and Emergency, get your IT person on it. Also, another key contact would be a great idea. Once they start meeting, there are emergency emails that go out to tell you what the state is doing, what each city is doing, what mode they're in, how they classify the emergency. They start usually 5 days out. We do the same thing as an executive leadership. We know there's a hurricane coming. We start 5 days out and work until the storm is passed. A lot of times, if there are local police departments, will shut you out of areas. So you really need to make sure that it's either your facilities manager or key personnel that can get reentry permits to whatever that local county, for our case, parish is, to get back in so you can get to your building, you can get to your facility. We do wireless priority service. It's a federal government program. We also do the GETS program, which is for telecommunications. That means that our phone calls will be diverted, will take priority, and that is something that's just really been essential for us to be able to get through and prioritize, because whenever an emergency happens, lines get congested and busy signals abound. So these two processes allow us to actually put a code in, and they'll prioritize our phone calls. The FBI InfraGuard is actually a program that will alert, our IT group is a part of it, and alert you about things that are happening at a national level and what they expect the fallout to be. So that's a really good program that we're actually a part of. Internally, we've started doing tabletop exercises, which I think are essential, and we've done them from things like a chemical truck overturning and the highway getting shut down around your building. How do you get in? So just, it doesn't matter the degree of which, but the tabletop exercises really cause you to think through things in a way that you probably wouldn't normally. We do virtual PBX for our call center. We don't have staff out of state anymore for the call center, but those staff can be relocated and actually use the virtual PBX system to take all of our phone calls. I highly encourage people to stay on cloud-based systems, so you have automatic backups. The area you're in won't be might be affected by whatever the event is, but your cloud-based system will make sure that you're still operational. Same thing with Verizon hotspots or whichever carrier you use, but Verizon's been great for us. Coming into your building, you need to have multiple internet connections, not just with the same company, but multiple companies. So we do redundancy. We have the cable company in addition to a phone company. Our IT department also has the ability to do toll-free routing of our phone numbers, which is really important, not just in storms, but when somebody decides to cut a line because they didn't pay attention to where they were digging. Your phone systems can go out, and we've had that happen. So fortunately, we're able to reroute, and we were able to get around that. I highly encourage a disaster website that only goes up. It can communicate to your community, your donor hospitals, but it also can communicate to your staff. And then staying in contact with your surrounding OPOs. Mississippi was essential for us. They were able to get things in, and then we were able to meet halfway to get supplies. Same thing with Houston. They're really great when a storm comes in. Kevin's the first one on the phone. Hey, what do you need? So I encourage that communication, not just within your OPO, but the surrounding OPOs as well.
Thank you. Thanks, Kelly. I think that probably all of you have inspired those relationships to be built or develop after this. Get to know your neighboring OPOs if you don't already, because we really can support each other. So thank the three of you. We have just a few minutes for questions, and I have a couple in the queue. So I'm going to just briefly ask, well, the four of you, did the emergency in your particular area stop operations completely? I think Guillermina said it did for one period of time, but could all of you briefly state how long you were offline officially with donation and transplantation?
Well, this is Kelly. I'll start.
Oh, go ahead. Go ahead, Kelly. Sorry about that.
Okay,
go ahead,
sorry. I don't do well with silence. We were, for Katrina, we were actually out for a week before we did our first case. So, but our #1 trauma center flooded, and we actually had a system where all of the traumas were flown in to that one trauma center. So all the surrounding parishes actually sent their traumas. So not only were we kind of in a tailspin, but all the hospitals didn't know what to do because they didn't have the trauma services available to them anymore. So 1 week for us.
Okay. Guillermina, how long for you? I think you went over it in your slide.
We never stopped operations. We were maybe in a semi-operational mode, but we we were answering referrals, we were following referrals, and within a couple of days we were already back going to rounds through the hospitals. And after less than a month, we did our first 2 cases. And 8 days after the storm, we had a non-donor.
That's right. That's right. That's wonderful. And Jessica, how long for you?
We remained operational through the whole period. Now, here in Houston, the transplant centers, the 3 main transplant centers suspended operations for 5 to 7 days, although we were available and we had placed our staff in hotel rooms inside the TMC. And of course, Fort Worth and Lubbock were fully staffed and operational. So I can't really say that we suspended our tissue services for 5 days.
Okay. Okay. I think that's all the time for questions we have, but I will get with the Alliance administrators to see if we can't get these questions answered in relation to what the apps might be for communication systems to staff. I know there's many different suggestions. There are a couple were on the slides there that people could utilize, as well as some questions about pay to staff during an emergency period and how do you budget that, and kind of how does that particular piece work. So perhaps look for an email forthcoming with some of that information addressed. And then Deanna, should I cover this for groups listening in together? If you could please select how many are in your group before you log off, that would really help us to determine who the audience was today.
Yes, thank you so much, Jacqueline. And I also would like to extend a sincere thank you to Jessica, Kelly, Guillermina, and David for such an interesting and I think much needed discussion. I definitely appreciate you taking the time to describe your experiences and share your key learnings as a result of the various disasters that you faced. And Jacqueline, I also like to thank you for your time and for taking on this presentation and moderating it. And to all of our participants, I'd like to thank you for your time as well. And if there are no additional questions, I'd like to wish you all a wonderful rest of your week. Thank you. Take care.
Please stand by.